courses at that site. So if we were to operate on him, there's a 25 to 30% chance that you would damage his shoulder function. So this patient would be counseled about it, and post-therapy, he would undergo physiotherapy for it.
Sir, this patient having hoarseness since 3 months, he would go to an ENT surgeon normally. And what is the percentage of cases being suspected to have malignancy? And is microlaryngoscopy the initial investigation that is followed?
Very good question.
I was
Devendra?
Neha from Grant Medical College.
Yeah, so when the patient goes to a doctor, a thorough evaluation is important. And there'll be a great variety of differential diagnoses for hoarseness, and one of them is having a lesion. So when you examine the patient in your outpatient department and you put in a Hopkins telescope or your just a mirror examination, you see something there. You see a lesion, you have to go to the next logical step of either doing a radiological investigation or putting the patient under anesthesia and checking out what that lesion is. So when you get a structural lesion, you need to further investigate that. If you have a reflux and it's just causing inflammation of the cord and that is why it's causing hoarseness, you investigate it according to that part. So when the examination will tell you what further investigations you need to do.
Devendra, she wanted to know, sure.
Yeah, I think that's a very good question, because I think your question is what percentage of patients with hoarseness are malignant.
Right.
In the UK, we have a referral system whereby the general practitioners, if anyone has hoarseness for more than 4 weeks, they need to be referred for urgent assessment to exclude head and neck cancer, and the conversion rate is between 2 to 5%. So less than 95%, more than 95% of patients with hoarseness do not have head and neck cancer. The numbers may be different depending on the region, depending on the risk factors such as smoking, for example. So you do need to take that into consideration. But in the UK, the probability of the pathology will be muscle tension dysphonia. It's likely because they've overused their voice. That's the reason why they're hoarse. So you do need to be careful where you send the patients, because the problem we're having in the UK is that a lot of patients, the patients with hoarseness, are coming to a head and neck cancer clinic and they get a flexible laryngoscopy, and I say, well done, you don't have cancer, go back to your GP, but they still have hoarseness. So they need to then go back to a specialist voice clinic. So you do need to have a system whereby you send the patient to the right clinician so you don't delay their treatment.
So the point in India is about the further delay. In India, you would have a general practitioner, you would have, you may not have an ENT specialist in that area. So the general practitioner would treat, and unlike UK, where they would have to strictly send to a referral center 4 weeks hence, this patient gets doesn't get diagnosed for almost 6 months. So the minimum time between the symptoms and diagnosis in India is around 6 months. So we need to work on that, because this needs to improve. Earlier you diagnose, this patient is more curable. So it's very imperative that we address this, and as general practitioners, they need to be made aware of what are the symptoms which may be a harbinger of malignancy.
So Prathamesh, adding to what Prathamesh said, what disease Prathamesh showed you, out of 100 larynx patients we treat, it may be 5 of them, 6 of them. Am I right, Prathamesh? Can we increase this number? Because what the discussion you heard was, can we do surgery or radiotherapy? Was never combined. Means that single modality is good enough for these patients, and if you treat them, 95% of them will be long-term survivor in this kind of patients. But what we see in the ground is that majority of the patient comes in was like a previous patient we were talking about. Surgery, radiotherapy, chemotherapy, all 3 of them, and then having a survival of around 30% or 40%, and we struggle with that. So if you can convert this in this kind, then you have a lot of more patients surviving.
Yeah, I think that's a very good point. And the take-home message would be the earlier you can get these patients, the better the outcomes. So the rates of laryngectomies, total laryngectomies, so this is more advanced surgeries, is going down at a significant rate in the United Kingdom. So, I used to do about 20 laryngectomies a year. now, and I think I haven't done one this year. And it's the same across so many other centers. And that is because we have a system, though it's frustrating because you're seeing a lot of patients who do not have cancer, but you're able to catch them, screen them, and catch them at a very early stage. So if you can put in place a system whereby patients with hoarseness immediately assessed, they have to have a flexible laryngoscopy. There's no other way around it. And then that way you can identify those very early who could, as you've been told, have either surgery or radiotherapy, and the outcomes are much better as opposed to needing to have more aggressive surgery.
Yeah, absolutely. Yeah, that's what I said. That yeah. Yes. Right. So it's very important that he gets diagnosed early, and it cannot get diagnosed early unless a specialist examines with a flexible or a microangoscopy. So your question was whether microangoscopy is a standard of care. Yes, if you find there's a vocal cord irregularity, you need to do a microangoscopy in order to evaluate the vocal cord and take a biopsy. So that is the standard of care today.
Prathamesh, an important point again, and he alluded to it. Any symptom that is not going away in our country is very important. We have nodes which are being treated for infection, for tuberculosis for 3 months, 6 months without doing the next step. If you see any symptom, though we know the chances of cancer are 5% or less than that, you have other various benign conditions, but keep it at the back of your mind. If your treatment is not working, then you must go to the next logical step and investigate the patient further and not just keep giving treatment, because we get patients with neck nodes who have been treated for 3 months for antituberculous and nobody's bothered to do an FNAC, and it's a squamous carcinoma. So you must keep it at the back of your mind. This could be cancer.
Name. What's your name?
And involves the cartilage of larynx, then will the surgery be considered superior to radiotherapy?
So we were to come to that, but yeah, let's answer that question.
So,
Why is it?
are you coming to such a...
Yeah, I'll come to that.
Then we will discuss that case.
Okay, let's discuss
But what
that.
Dr. Sharma was trying to say that we did a study in Tata Hospital about the delay of diagnosis. So there was average 6 months delay in diagnosis of oral cancer, average 6 months. Of those 6 months, 3 months was because of the patient and 3 months was because of the doctors themselves. So you must understand that doctors are responsible for half of the delayed diagnosis that we are having, because we ourselves are not trained for early diagnosis. We just, antibiotics or mouthwashes or whatever. And oral cancer is something that you can see by own eyes. You don't require any fancy investigation. So this is very important. Oh yes. And some people are treating cancer by lom vilom and pranayam. You know that?
Okay, so we'll go to this next case.
So the last question, sir. So if Harshal from JJ, if there was a case like you said that the age is a criteria. So if someone comes to you he's 35, you said, and he comes to you, so would you suggest radiotherapy or would you direct him to surgery? And tell him to go somewhere else. Like if you are in a center where you don't have the facility, would you go ahead with radiotherapy or would you send him to a center that has...
So you don't have the expertise in your center?
No, so I'm saying if you were in a situation...
So again, what you are saying that we don't have the facility for either of the two.
No, so if he's 35 and we said that radiotherapy...
See, again, I'm telling you that availability or non-availability should not be a reason for you to offer a diagnosis. You must inform the patient. You must make the patient as, the source of, is a decision maker.
Yeah.
You tell him that there is an option of laser, it's not available in a hospital, but in this world, there will be a laser available 1 hour away. Give the option to the patient. Let the patient decide. We should not be deciding on the behalf of the patient that we do not have laser, please go ahead with radiotherapy. That's not the correct approach.
I don't know what the legal system here is like, but we have very recently we had a legal case in the United Kingdom It's called the Montgomery Law, if you want to Google it. And what it basically said is that the previous principles that we used to work on, what we call Boehm's principles, which is what a considered body of medical opinion would consider the best treatment, that no longer is the way to treat patients, that you have to make them aware of all the options and all the potential complications with each option, and then they choose. So because if I had a situation in the UK where a patient was sent for radiotherapy and they had a side effect, and they came back and they were made aware by their friend that they had laser surgery and they didn't have any of the radiotherapy side effects, they could sue the hospital, and they will probably win their case because they will be told, well, they did not have the choice to decide which option is best for them. So I don't know if you have a similar legal precedent here in India, but that is something to consider.
Good afternoon,
Tradition
sir.
in India that doctors used to marry doctors, you know. But I think we should all marry lawyers now. You know, surgeons used to marry anesthetists, pathologists, you know, forming nursing homes. But it is very important what he is saying. 5 years from now, you will have lawyers coming after us. In India, it is not a problem at this point. But I'm sure that days are going to come soon.
So I'll tell you what.
But
will
your
the-
wife can sue you as well, you know.
Ready for that.
So, you know, what will be the worst scenario will be, it shouldn't happen that in the fight of the two treatment and referring somewhere else where you think it may be possible, it's available, patient doesn't take a treatment, and what you saw